Assalamualaikum and hi, I am Nuzul Fitrah binti Ibrahim. So basically, a congenital anomaly is a disorder that occurs that exists at time of birth. Codes from this chapter are not used for maternal record. There are 11 code blocks in this chapter. First, this code block shows some congenital disorder may have present at birth. They sometimes do not become obvious until later in life. And a condition that occurs during birthing process is considered as perinatal condition and coded in chapter 16. For example, spinal bifida condition. It happens when a baby's spine or spinal cord are not developed properly in the bone, causing a gap in the spine. Second, this code block report condition as cataract, glaucoma, other malformation of eyes, ear, face, and neck. Codes are organized according to the specific site and type of malformation. Third, these codes are categorized according to the specific site of the circulatory system. Coders must determine the specific site of the circulatory system malformation prior to the selection. Fourth, some anomalies code in this section are not present right away, but are diagnosed later in life. If they are determined as congenital, it's still coded in this section. Fifth, cleft palate is a congenital groove or opening in the palate. Meanwhile, cleft lip is a congenital defect of the result in the deep groove of opening of the lips running up to the nose. Six, digestive system like tongue, mouth, pharynx, congenital accent, and others. Seven, genital organ like ovaries, fallopian tube, and broad ligament. Eight, urinary system like renal agenesis and other reduction of kidney and cytic kidney disease. 9. This code block is organized according to the various anatomical side of the musculoskeletal system. It's laterally is identified in many codes. 10. This block report condition as malformation of breast, skin, and integument. And lastly, 11, the code report condition as Down syndrome, trisomy 18 and 13, other trisomies, sex chromosome abnormalities, and other chromosome abnormalities.
Hi and Assalamualaikum. My name is Nurin Haziqah. In this presentation, me and Hazirah will present about the guidelines from chapter 17, which is about congenital malformation, deformation, and chromosomal abnormalities. First of all, to begin with the basic of this chapter, when we do coding for chromosomal abnormalities, malformation, and deformation, we should use the code from the code range of Q00 until Q99. Next, when we do coding for this chapter, it can be diagnosed on a patient record as principal diagnosis or secondary diagnosis. For further information, when we do coding and if the congenital malformation, deformation, and chromosomal abnormalities is specifically identified and the manifestation with the anomaly has an inherent component, the codes should be coded together and not separately. Meanwhile, if the manifestation does not have an inherent component, the additional code should be assigned. Last but not least, if a malformation, deformation, and chromosomal abnormalities does not have a specific code, additional code for manifestation that might be present should also be assigned. Next, I will pass this presentation to the next presenter, which is Hazirah.
Hi, my name is Nur Hazirah binti Zubir. Code from chapter 17 may be used throughout the life of the patient. In the event that a congenital malformation or deformity has been rectified, a personal history code should be utilized to identify its history. An anomaly may not be discovered until later in life, even though it is present at birth. A code from Q00 until Q99 range should be used whenever a medical professional makes a diagnosis. The relevant code from category Z38, life-born infant, should be sequenced as the primary diagnosis or PD for a newborn admission, followed by any congenital anomaly code Q00 until Q99 according to the place of birth and type of the delivery. fourth, fifth, and sixth character used in categories Q00 until Q99. Most of the fourth character used in category Q00 until Q99 add further specificity, define the level of severity, or provide the anatomical location. The fifth and sixth character in the chapter 17 define laterality or anatomical site primarily. For example, in Q27 form 3, arteriovenous malformation, peripheral, the fifth character is site unspecified. The fifth character of 1 is the upper limb, 2 is the lower limb, and 3 is the digestive system vessel. The term peripheral in this code description identify an arteriovenous malformation in any part of the peripheral vascular system which exclude the circulatory system organ of the heart and major coronary blood vessel almost exclusively. Six characters are used in only few instances in chapter 17, usually to indicate laterality or anatomical site.
Assalamualaikum and good day to Dr. Dila. My name is Nursabrina Zulkarnain, and now I would like to continue this presentation on this case study about this chapter. This 84-year-old male patient recently diagnosed with polycystic kidney disease presents today to discuss his treatment options. At this point, he is not experiencing any end-stage disease symptoms or any acute symptoms. I discussed with him and his wife that he is a progressive disease and it is more than likely he will need a dialysis as the disease progresses. He was instructed to follow up with me in 8 weeks. So the principal diagnosis for this case will be Q61.3, which is the polycystic kidney unspecified. In order to find this code, the first step is to search polycystic in the index. Then, go to the tabular list and find the code that presents in the index, which is Q61.3. You will now find the principal diagnosis for this case study. In conclusion, patients are most often diagnosed and treated for congenital anomalies during the neonatal period, but an individual may be diagnosed and treated at any age. Some congenital anomalies can produce long-term disabilities that require a lifetime of care. That will be all from us. Thank you.